Something unique we're doing is using what's called a periolace. The periolace is a laser that was developed specifically for the treatment of gum disease. People use lots of different lasers for various forms of gum treatment, but this is the only laser that has a FDA-approved, patented protocol that's been proven to regenerate bone and connective tissue around teeth. If you have bleeding or shifting of your teeth, or you've noticed spaces, you need to see us for a thorough periodontal examination. Most people don't see the dentist regularly, have no idea of the status of the health of their mouth, and even many people who have seen dentists in the past have never had a periodontal examination. So if you have signs, you need to see us for an examination. Well, one of the most exciting things we have available is a new laser called a periolace. Lots of people use lasers for various forms of gum treatment. This is the only laser that's FDA approved and has a patented protocol for treatment of gum disease, and has been researched and shown to regrow bone and connective tissue in many circumstances. Traditional treatment of gum disease involved making an incision, reflecting the tissue, recontouring the tissue, and stitches, and often that was something that seemed very threatening and overwhelming to people, so a large percentage of people wouldn't follow through with treatment. The advantage of the laser is it allows people to return to their normal activities much sooner. It's much less invasive, and it's really an attractive alternative to conventional gum surgery. Well, as opposed to just cutting away tissue, the new periolace has an optic fiber that's inserted into the pocket, and it selectively removes the diseased tissue. Also, it makes it easier to clean the teeth, and it stimulates formation of bone and connective tissue. So there are no stitches, no incisions, and just a much more pleasant procedure for the patient to undertake. The periolace involves placing a fiber optic into the pocket, and the laser energy selectively removes the diseased tissue. It also makes it easier to properly clean the tooth and stabilizes the area after the procedure, so the patient heals much more quickly. It's a much quicker procedure for the patient, much less discomfort. It's a very attractive alternative to people compared to conventional gum surgery. One of the big advantages to the periolace is it's minimally invasive for the patient. There's no scalpel, there's no stitches, and recovery is much quicker, much less discomfort. It's just a huge advantage for people. The advantage of the periolace is it's much less invasive, much less discomfort for the patients. They can return to their normal life more quickly. The periolace is going to do for gum surgery what LASIK did for eye surgery. The periolace involves placing a fiber optic into the pocket, and the laser energy selectively removes the diseased tissue. It also makes it easier to properly clean the tooth and stabilizes the area after the procedure, so the patient heals much more quickly. It's a much quicker procedure for the patient, much less discomfort. It's a very attractive alternative to people compared to conventional gum surgery. Traditional treatment of gum disease involved making an incision, reflecting the tissue, recontouring the tissue, and stitches, and often that was something that seemed very threatening and overwhelming to people, so a large percentage of people wouldn't follow through with treatment. For people who've avoided gum treatment because they were frightened or afraid, they don't have to be afraid anymore. The advantage of the periolace is it's much less invasive, much less discomfort for the patients. They can return to their normal life more quickly. The periolace is going to do for gum surgery what LASIK did for eye surgery.
Well, we've got this new laser, and he said it gets rid of the bad gum tissue around your teeth, and your new gum tissue grows back healthy, and you don't have to take any extra medicine for it, and that's pretty much it. And I said, okay, I'll do it. So
the results were great. My partial plate, it did embarrass me because it did pop out, and it was always food stuck in there, and it got, it was pretty, it was embarrassing, yes. I was very self-conscious on my partial. I kept on, I'd always hold my hand up to my face so people couldn't see my teeth. My dentist, my regular dentist, told me that I could have some permanent teeth, implanted in my mouth. So he recommended Dr. Skinner, and I came over here, and he educated me on how that procedure would take place. I thought that to have permanent teeth back in your mouth was like a pie in the sky. Yes, I was very afraid at first to go ahead and try anything different. I wanted to keep my regular teeth, that I had in my mouth, because I just didn't particularly want to wear dentures at all. I was not aware of the overall health of my body, how my teeth affected, bad teeth or gum disease actually affected my body until I talked to Dr. Skinner, and he told me about that. And after I had the procedure done, of course, I do feel 100% better. I really contribute my teeth to that. My smile, I haven't smiled for about 20 years. Otherwise I always hold my hand up to my mouth, and I was ashamed of my teeth. And I'm pretty proud of them right now. They look pretty good. I'm smiling every day now. I have not stopped smiling since I had the new implants on my teeth. So I still didn't smile probably. Now I can. The difference between dentures and permanent teeth is night and day. Dr. Skinner is an awesome person. He informed me, anytime I was nervous or not sure of what I was, he enlightened me on every procedure there. And, that means a lot, especially when you come in here and not knowing what is going to happen. So I respect him for that. Really a professional person. His experience level is untouchable. I just feel young. Again, I feel, my mind tells me I'm 20 years younger than what I am. My smile tells me that too. So, I feel great. I really feel great for the age I am.
I ignored it. I hoped it would go away on its own, and it didn't. I have always had a fear of dentists from my earliest childhood, and dental discomfort is something that I prefer to not to participate in if I can avoid it. And so that was it. I didn't want a treatment which would be uncomfortable for me, painful for me, and that's why I ignored the problem. Post-operatively, it was amazing. I took 2 Tylenol after the first procedure, nothing after the second. When you have the opportunity to visit someone like Dr. Skinner, who has trained and equipped himself to perform a procedure like this, you almost count yourself lucky. It was much less uncomfortable than I anticipated, and I was grateful for that. Recovery was amazing. It was done in 2 separate procedures, and after the first procedure, I took 2 Tylenol for pain on the day of the surgery. Nothing thereafter. The second one, I didn't need anything because I took the Tylenol in anticipation of pain that really didn't exist. So recovery was 48 hours to not to complete recovery, but to the absence of any discomfort, and in both cases. And I found that really amazing. I feel great. I really do. I think it's very important that Dr. Skinner has equipped himself and educated himself to the point that he can do and use this technology. I think that one would be remiss if they didn't seek out a board-certified periodontist.
What would you say to somebody?
I would say if you go to Dr. Skinner and talk to him, your anxieties will be relieved. And based on my experience, you will have less discomfort than you've ever had with any dental procedure. Certainly the relationship between gingivitis and heart disease is well known to most medical professionals. I think that some of the other issues are not as well known, nor have they been as well publicized. The pancreatic cancer relationship, I think, is largely unknown, even in the medical community. So it's perhaps something that should be better publicized. I think that most people do not know what consequences bad dental health and bad dental hygiene can have in their later life. And I think that if you ask the majority of people what is a periodontist, you'd get some strange answers. I don't think that people like Dr. Skinner have promoted themselves to the extent that they should. It's a beautiful office filled with very nice people. I have been pleasantly surprised by the quality of the people that I have dealt with here. They all seem to be informed and interested and helpful, and I could not have asked for a better experience. Dr. Skinner is able to put people at ease very well. Anyone who has a conversation with him will immediately grasp that he knows what he's talking about and is concerned about the person to whom he's speaking, and views them not only as a patient but as an individual.